As a follow-up on talks surrounding the recently commissioned COVID-19 hospital, Minister of Health, the Honorable Dr. Frank Anthony, announced that the Auditor General and the team will be extensively investigating and auditing finances which went into the project. Here are the details.
The facility at Liliendal on the east coast of Demerara was commissioned to deal exclusively with infectious diseases. However, the new health minister has found that the hospital cannot readily treat COVID-19 or other complex cases, as there is no equipment or beds within the facility. For this reason, an audit was ordered to determine how the $1.6 billion was expended to rehabilitate the building, which was formerly a hotel.
If we're spending, and if these sums of money that we're told were spent on the building, then the Guyanese public deserves to know what it was actually spent on. $1.6 billion is a lot of money, and therefore people deserve to know. And the only way we can know that is to have the Auditor General and his team do that type of audit and present those results to us.
A team has already visited the facility to do initial assessments. With the Auditor General's report, the ministry will then be able to move forward with an informed decision as to whether the $1.6 billion project was financially viable and if the facility can actually be used. This will be supported by the assessment of the medical technical team.
Let's assume that we are going to be taking the facility and wanting to use it. We still have to do these works of inserting these piping systems and so forth.
Therefore, some tearing down still to be done.
A lot of renovations would have to be done for that section of the hospital to be used for the purposes that it was intended.
The minister reflected that in recent years, an Auditor General's report highlighted several faults with the COVID-19 hospital then referred to as the Ocean View Hotel. Minister Anthony said this ongoing investigation will determine if these issues still exist. For InfoHub, Delicia Haynes.